United States has about 5% of the world's population and 20% of the world's deaths. Fortunately, in the last year or so, the government has gotten its act together and doing much better. But the whole process with the vaccines, the government did a really good job of trying to get vaccines made, but they did almost nothing about how do we get vaccines to the community. And these are the questions I constantly get is, why can't I get my vaccine? And there was just there actually was no planning about how to deliver the vaccines. And now, fortunately, there's more vaccines being made. The other point I wanted to make about the pandemic is that very often people talk about, why is the pandemic happening to us? When will it end? And that's true, but it's equally true that we are the pandemic, and the pandemic is us. At any point, if we could get 95% of the community to wear masks, the pandemic would have been over in 6 weeks. And I'm going to come back to that, in that we really can't be detached from the pandemic, because our behavior really determines what's going to happen next. Okay, so this is the current state of vaccines. This comes from the New York Times. What I'd focus on is that second to one from the right, that there are 6 vaccines approved for full use. 3 of those vaccines are in the United States. 3 of those are in other countries. And it's really important that the entire world get vaccinated, because as we've seen, viruses can travel from one part of the world to the other. But as of now, there are 3 vaccines approved in the United States. The most recent one is the Johnson & Johnson vaccine. And that vaccine has some really helpful characteristics. The other 2 vaccines that are available, the Moderna and the Pfizer, require super cold storage, so that most small places like a doctor's office can't stock them. The other benefit of the Johnson & Johnson is it's only 1 shot. So one and done, especially for people who don't like needles. The Johnson & Johnson vaccine is really attractive. Let's talk a little bit about the efficacy, or how well each vaccine works. And they're all they're all highly effective. To need to understand is, for a vaccine to get approved, it needs to be at least 50% effective. And we are happy when a vaccine is 50% effective. And these vaccines are incredibly effective. They're more effective than most of the other vaccines we have. Some people got hung up on the Johnson & Johnson vaccine, in that the 66%, that the prevention of any symptoms, and that is definitely lower than the Pfizer and Moderna. But the most important thing that we all care about is preventing hospitalization and death. And it's 100% effective for that. So if it means people are going to get a cough or feel lousy for a couple days, but they're going to come out of it without having to go into the hospital, I'm okay with that. And so people ask, what vaccine should I get? It's the first one you're offered would be the vaccine I would take. I would take any of these vaccines. The Johnson & Johnson vaccine works differently than the Moderna and the Pfizer. The Johnson & Johnson vaccine, they basically took a cold virus that doesn't hurt you, and they put some of the messenger RNA. They took bits and pieces of the COVID virus, not the virus itself. And then when that's introduced into a person, you're able to generate an immune response. And that's how that vaccine works. The other two vaccines are mRNA vaccines, and let me explain what those are, because there was concern that the mRNA vaccines will alter your DNA, and that absolutely positively does not happen. It is not biologically possible for that to happen. So let me explain how the mRNA vaccines work. In your body, there are three things. There are genes, and then there's the mRNA, and then there's where the proteins are made. So I'm going to use an analogy of something near and dear to my heart, which is cookies. So if you took a book of cookie recipes, like Mrs. Fields, my go-to favorite, those are all the recipes for the cookies, and those are equivalent to genes. The genes are the recipes for the various proteins and parts of your body. But the genes stay in one place. And so the question is, how do those recipes get translated? And so what happens is those recipes get copied by mRNA. And it's those copies of those recipes that are taken out into other parts of the body where the cookies are actually made. So the book stays in one place, just like your genes stay in one place. So continuing this analogy further, in your cells in your body, in the center of the cell is where the DNA is made. And we would consider is where your DNA is, and that's considered your library of your genetic code, or in my case, the library for my cookie books. Once the DNA is, you need copies of it because it can't leave the center of the cell. And those copies are mRNA, and those copies leave the center of the cell, and those go into the cell, other parts of the cell where proteins are made. So this is another way of looking at this. So this is a cell in your body. And again, you see in the center of the cell is the nucleus, and that's where all the DNA is. That's where the library is. And you can see those white dots are the mRNA coming out of the cell. And what the mRNA vaccine does is it introduces additional mRNA into the cell. But it never enters the center of the cell. So it's not touching the genes, it's not touching your DNA, it's not going in there. They're two totally separate things. So what happens, excuse me, I'm sorry, hang on one sec. Apologies. So what happens is, let's say I want to make my favorite recipe, which is chocolate chip cookies. And what the vaccine would do is, as the cookies are coming out of this, as the recipe is coming out of the cell nucleus, the vaccine is introducing another recipe. So that when it goes into the cell, now the cell's not making only chocolate chip cookies, it's making oatmeal chocolate chip cookies as well. So the question is the vaccine safe? And that's an entirely appropriate question to ask, but you have to ask a second question, which is, what is the risk of not getting vaccinated and getting COVID? If COVID were a really rare disease with a really low chance of getting seriously ill, then we could take our time with the vaccine, and we could make 100% sure it was incredibly long-term safe. But the problem is you have this raging pandemic that is definitely causing death and illness. So we have to compare those two. So let's talk about vaccine side effects. Temporary side effects after injection are really common. Headache, arm pain, they can be significant. I'm sorry, I have to wait 1 second. I have to get my dog. I apologize to Judy ahead of time. Be right back.
Just so you guys know, I had the first injection of the Moderna vaccine a couple weeks ago, and the only reaction I had was my arm hurt for about 24 hours a bit, and it wasn't totally uncomfortable. So I hear that the second one tends to have more reaction, although my husband has had both and he didn't have much reaction.
My wife had a miserable headache for 2 days, really pretty bad. But yeah, so about 75% of people will get some type of short-term side effect. Severe allergic reactions are very rare. When they've occurred, they've been treating. The long-term side effects of the mRNA vaccines are unknown. Theoretically, the risk is very low because they get degraded by the body pretty quickly. Also, a general rule for vaccines, long-term side effects are incredibly rare. You can get significant side effects. If they're gonna happen, they usually happen pretty quickly. It's really rare to get long-term side effects from vaccines. So talking about severe allergic reactions, again, they've occurred only in people with a history of severe allergic reactions. People who need EpiPens, for example. The only people who are ineligible to get the COVID vaccine are people who've had an allergic reaction to components of the vaccine. So in other words, if you had an allergic reaction to your first injection of the vaccine, then you wouldn't be eligible for a second dose. But certainly if you have severe allergies, you'd want to talk to your doctor. Reports, let's talk about deaths from COVID right now. One of the reasons I feel good about the vaccines is that there's a really stringent and robust reporting requirement. So as of now, the last time I checked, there were about 1,700 cases where people died within getting the vaccine. So they got the vaccine and there was a death within the first 2 weeks of getting the vaccine. So far, of all of those reports of death, none of them have been attributed to the vaccine. They've all been the ones so far, they've all been investigated. And similarly in Europe, there's been about another 1,000 or so deaths following vaccines. And with them too, there have not been any conclusive cases where it's been shown to be the vaccine. I'm not saying it can't happen, just so far, and they've given an awful lot of vaccines and there hasn't been evidence for it yet. Other vaccine questions. If I had a reaction to the flu vaccine, will I have a reaction to the COVID vaccine? Not necessarily. Again, they're different components. If you do have a history of severe allergic reactions, you talk with your doctor. Can I take Motrin or Tylenol if I have side effects from the vaccine? There's been a lot written about this because recall that the whole point of getting a vaccine is to generate an immune response. So if you're taking anti-inflammatories, in theory, you're reducing the inflammatory response, which is you want. Part of the thing you're getting from COVID, the fever, the muscle aches, that is your immune response kicking into gear, and that's what you want. So what I would say is I would not take Motrin or Tylenol ahead of time just to try and prevent side effects from happening. If you have side effects and they're mild, I would try to do simple things like cold compresses. But certainly if you're in significant discomfort, you absolutely can take Motrin and Tylenol. So now we've talked about the vaccines. Let's talk about where and when can you get the vaccine. So March 15th, people with disabilities who are eligible to get the vaccine. It's people at high health risk, as well as, if you look at the bottom of the screen, if you, as a result of a developmental disability, any of those things are true, you can get the vaccine. Now, all people are simply need to self-attest that they meet to these criteria. You don't need to show doctor's records. You don't need to show proof. You just need to, they're going to give you a form and you just need to state, yes, I meet these criteria. So that anyone who belongs to the regional center is eligible for the vaccine based on this. And other people who are not part of the regional center can be eligible as well if you feel you meet any of these criteria. Part of the challenge with the vaccine is there are just so many different places to get this. And the state realizes it's overwhelming because there are so many different places. So they're working toward a single portal, myturn.ca.gov. And I'd suggest you register with it if you haven't. When it's fully up and running, they're gonna have, in theory at least, all of the places where you can get a vaccine in one place, and you can look up and they'll come up with this list of options for you. I wouldn't rely solely on them, but it's a good place to start. Other places are giving the vaccine, like Walgreens, CVS, and Rite. Several of the health plans are giving the vaccine even if you're not a member. So even if you're not a Kaiser member or an Alta Med member, you still can get the vaccine through them. You just you need to do that through their website. Other places to get the vaccine are your health plan or the county. Hey, knock it off. So again, these are places you shouldn't be going to individual retail stores to get the vaccine. You can go online. Rite Aid, CVS, and Walgreens all have websites where you can go and register for the vaccine, and they'll pull up a list of stores, because what places they give the vaccine will depend on how much vaccine they're getting. And fortunately, there's, the vaccine production is going up. So this is the Kaiser website, and you can either go online or you can call them, and you can register even if you're not a Kaiser member. So as we're getting vaccinated, slowly the restrictions are being lifted, but I would urge caution, and the CDC has said that we can start getting, we can start meeting in small groups. I still would strongly urge that you not be with large numbers of people in the same room. I personally will not eat inside of restaurant yet. Eating outside is great, takeout is great, but being with large numbers of people in small places is still really tenuous. And there are a number of countries in Europe where they thought that that the pandemic was going down, and they opened up too quickly, and cases are surging again, and they're having to close down again. So, we're getting there. We've come a long way, but we probably have another 2-3 months, and just opening up completely would be a really bad mistake. Okay. they have done analysis again where the virus spread where restaurants reopened and mask mandates were absent. So I would urge people to continue wearing masks in public, especially if you're in areas where there are a lot of people. So the other, the thing that everyone's talking about and that we have to watch out for are COVID mutations. And we've all seen these on TV. And some of the mutations have weakened the effect of vaccines. Fortunately, the vaccines are so incredibly effective that even though the variants are not as receptive to them, they still work. But the big fear is that a mutation is going to come along that the vaccines aren't going to work. And in fact, more than likely, we're going to need booster shots of the vaccines. And Moderna is already planning on a third vaccine specifically tailored to the variants. So again, we have a role in determining whether or not COVID mutations happen. It's up to, if you wear a mask and you don't get COVID, it's not possible for a mutation to happen. And it's entirely possible for someone who is young and healthy to get COVID, for it to mutate to a more deadly form and then spread it in the community. And so none of us want mutations to happen, but there are things we can do to reduce the chance of that. So the end is in sight and the pandemic is ending, but how long it takes and what shape that is, that's really up to us. And there are states now that the numbers have stopped going down, and that's really concerning. I mentioned that problem in other countries, that everyone's familiar with the 1918 pandemic. There was actually a second wave in the pandemic when people had thought the first wave was over and they were tired of the public health measures, and people stopped social distancing and wearing masks, and that's when the most people were killed. So again, we're getting there, but we're just not there yet. I have to, to be honest, this is not going to be the last pandemic. And part of why the United States did so poorly with this pandemic was our public health had been poorly funded and disease surveillance had been poorly funded. And with climate change, people are getting squished into smaller and smaller areas. And people in wildlife are getting pushed closer and closer together. It's estimated that there are about 1 million viruses that are currently in animals that could be transferred to people. So we really need to learn from all of the pain of the pandemic so that when the next pandemic comes, and it will come, we can jump on it and not another 500,000 Americans die. So it's a combination of hope in terms of this pandemic, the end is in sight, but we just need to be careful or history will repeat itself. And I think that's it. I know that's a lot of information.
It's a lot of information, but it was very good information, and we have quite a few questions. So I'm going to go into gallery mode, and I'll just let, if it's okay, I'm going to let people ask the questions themselves. Martin, you want to go first? You had some questions for Dr.
Yeah,
Himber.
Dr. Himber, I'm a client of the regional center, and I've been receiving emails about the COVID-19 vaccines, and I heard that, and I heard Rite. I mean, I read the emails that you can get sorry, can get the vaccines from Rite Aid and CVS pharmacy. Yeah. So my question is, well, my dad and my stepmother tried to register for me online, but they said that they're not my age group is not available. My age is currently 35. Yeah. Is that true? Well, I mean,
you cut out for part of that. Could you repeat that?
oh, I'm sorry. Yeah. Well, my stepmother and my father tried to register me online for the vaccines, but it was, but they couldn't because my age group, which is 35, is not available.
No, you can.
Yeah, this is the problem we discussed, Dr. Himber, that the websites don't reflect the latest, especially the CVS one. I know that it's basically national in terms of priority. So if there's something special to California, it doesn't necessarily reflect it on the website, the criteria.
Yeah, I think I'm hoping now that California is such a large portion of, has so many people that they will be taking that into consideration. But I will bring that up. I know someone at CVS and I can follow up with them.
Yeah, okay. But today is March 15th, and I thought it's going to be available right now for all of us, like for our younger ages.
Well, now there's not enough vaccine to go around right now. So you know, there might be a delay depending upon where you go and how soon you can get the vaccine, but it is available for anyone with a developmental disability right now. You should be able to get the vaccine, and you can get it through the county.
Yeah, and I was told that I should get it through Rite Aid and CVS, and you're right. I should get it through those pharmacies.
Right, you can. There are a number of places you can get it through them. You can get it through Kaiser. You can get it through UltraMed. There are a number of different places, number of different ways you can get the vaccine.
Okay, thanks.
You're welcome.
So our next question is from Savag. You want to take yourself off mute, Savag, and ask Dr. Himber the question?
Oh yeah. Thanks, Dr. Himber. If you take a care zone ill, can you get the COVID-19 vaccine? And after what part of the vaccination can you go out in public and not worry about wearing a mask being transmitted from the disease? Can I choose the Moderna COVID-19 vaccine? And if I'm a regional center client, where can I get the vaccine?
So a couple things. You are considered immune 2 weeks after your second dose of the Moderna vaccine. Even if you get the vaccine, you should still be wearing a mask when you go out in public. You don't need to wear a mask in the home. You don't need to wear a mask if you're around other vaccinated people in a small group setting. But if you're going out in the community, you should still be wearing a mask. As far as getting the vaccine, again, you can get it through the pharmacies. You could get it, you can go through Kaiser, or UltraMed will accept non-members, so you can go through them as well. So there are a couple different alternatives, and how fast you can get it at each of those depends on the supply of the vaccine, but as the supply is getting better, that's becoming easier.
Also, when should I worry about getting the third booster shot from Moderna to get immune from the mutations that come from other parts of the world? And after the second shot of Moderna, am I immune from the mutations, or do I have to get a third booster shot for the mutations?
You are currently immune from the mutations. Moderna is saying that they are in the process of developing a third shot. I don't see that happening anytime soon, but they'll make an announcement. But for now, you're covered. You're covered against the current mutations. So that's going to be happening down the road. I can't tell you exactly when that will happen, but it's not going to be anytime soon.
And do you think I need to get a third booster shot? And would you
Not now, no. There is no third booster shot to get right now. They're still developing it. So eventually, yes. And I'm sure, you know, there'll be a lot of publicity on when that's available, but it's not going to be anytime soon. So don't worry about it now.
Thanks.
I have a question, but anybody else who has a question, you can raise your hand or use the chat. So I took the vaccine a couple weeks ago. I didn't realize I shouldn't have taken any ibuprofen beforehand. So I did. Is that a big problem, or, and I haven't had the second dose yet. So I figure.
It is not a big problem. It's more of a theoretical possibility. So no, definitely wouldn't worry.
You shouldn't have, but it's okay. Any other questions out there?
Oh yeah, I've been through the drive-through vaccination shots, and then it said for my first Moderna shot last week, and it kept me for like half hour to make sure there was no reactions.
Yeah, that's pretty normal.
Yep.
Myra
Yes.
Yeah, you want to ask your question?
Yeah, so I have two questions. The first one is, you mentioned Moderna about the 2 weeks after the second dose being immune. What about Pfizer and Johnson & Johnson's?
Pfizer, it's I think 3 weeks, and Johnson & Johnson, I'm not sure, but I think I'm not sure about the Johnson & Johnson. It's most of these, it's 2 to 4 weeks. Certainly a month after, you'll be fine.
Okay, and then my next question is, I know you mentioned earlier that it'd be best to just take whatever you're offered first.
Absolutely.
But does that mean that you have to, how could I explain this? So if you take the Johnson & Johnson one, then you can't get the Moderna third dose for the
booster
variants. Yeah.
You know, that's an interesting question, and they're trying to figure that. I don't think they've figured that one out yet.
Okay.
But the Johnson & Johnson was tested and was effective against the variant. So I think my answer would be is that all of these vaccine makers are taking really careful viewing of the variants as they come up, and they all realize this is a potential issue. So that certainly they will make an announcement if and when they feel that what's out there is not adequately covered. So they'll let you know if and when there's a concern. So I wouldn't take the Moderna third vaccine. If you got Johnson & Johnson, I would wait to see what they said.
Okay, thank you.
You're welcome.
There's there was a statement from Carrie, and she mentioned that CVS will give if at the end of the day they have some vaccination left over, they'll give shots to whoever comes in. And then Janet, do you want to ask the question, or I'll ask for you? She says 16 to 64 is a big age group for people without underlying conditions. Will Othena be giving priority to the seniors rather than the teens? Well,
right now, anyone who qualifies for the vaccine can get registered. There's a certain percentage of the vaccine is reserved for communities that have had difficulty accessing the vaccine or at high risk communities. So there's a certain chunk of the vaccine dedicated to that. There's a certain chunk of the vaccine that's dedicated to teachers and other teachers and other groups. But if you're eligible for the vaccine, you're eligible for the vaccine. So right now, you know, teens through 16 to 64 are without underlying conditions, those people aren't currently eligible. It's only people who 16 to 64 who do have underlying conditions. So for now, those people cannot get the vaccine. So I don't think that's an issue. So I don't know if that helps.
Peter, do you want to explain the reason I got the vaccine was because of the caregiver community that was allowed to get vaccinated a couple weeks ago. There were some notifications from Regional Center. Do you want to explain that briefly?
Sure. So there also are the people who are also eligible to get the vaccine are family members who are caregivers of individuals at high risk for medical complications from COVID. So what that means is, let's say if you have epilepsy or cerebral palsy, those are eligible conditions. If you have autism and a medical diagnosis, autism and heart problems, or autism and lung problems, then your parents, caregivers can get the vaccine. So yes, family members can get the vaccine if the person they're caring for is at high risk, has some type of a medical problem. So what that means is if you're someone who has autism and do not have any other health problems, then your family members could not get the vaccine. But if you do have a medical diagnosis, then your family members can get the vaccine as well, provided your family members are caretakers. So your 6-year-old brother can't get the vaccine, but if your mom and dad are caring for you, your mom and dad can.
Peter, you want to explain about the age group that this is relevant for? Like how young of children can be vaccinated, and does it change by the type of vaccine?
So right now, the youngest that can get vaccinated is 16-year-olds. And I forget whether it's Moderna or the Pfizer, one is 16 and one is 18. They're currently studying in 12 to 16-year-olds, and that information will probably be ready in the summer sometime, is when they're anticipating 12 to 16-year-olds getting it. And they're just now starting studies of younger kids, and younger kids probably won't be ready until the fall.
Okay. And I know that there's supposed to be federal run vaccination centers. Are there any federally run vaccination centers in Orange County at this point?
They're called FQHCs, and yes, there are several of them in Orange County, and I don't have a list of all of them.
Okay.
But yeah, there are several in Orange County, and I can try and get that to you.
Okay. So are there any other questions from our group here? It doesn't look to be like. Thank you so much, Dr. Himber. This was so helpful. And thank you for your hard work, because I know. And why don't you mention the regional centers twice a month presentation that you give?
Sure. Every Wednesday at 10 a.m. I'm sorry, every other Wednesday at 10 a.m. we do a community update on COVID, and anyone can register for it. Anyone in the community can register for it. And the next one is this Wednesday, where we'll be doing a COVID update, and I'll be covering some of the stuff here and some new stuff as well.
Okay. Well, thank you.
It was a pleasure meeting you folks.
Okay, thank you. If you guys